Hello, everyone, and welcome back to the Black Women's Wellness Lounge. This is me, Brandon. So excited to have you all here for another episode. And so this one is one that I think is really, really needed. One that I get questions about all the time, and so I'm so excited to have my guest on today. And so I'm going to bring her here. And so, Dr. Corey, thank you so much for being here. I'm excited to have this conversation with you today and to really talk about psychiatrists and talk about what that process is like, what their process is like for parents who are looking to get their child into their meeting with a psychiatrist. And so, thank you so much for being on today.
Oh, you're very welcome. Thank you, Brandon, for having me. It's a pleasure.
Awesome, awesome. Thank you so much. So first things first, let's have you introduce yourself to the Black Mental Wellness Lounge.
Sure. Hi, Black Mental Wellness Lounge. I'm Dr. Maria Trent Corey. I'm a board certified child and adult psychiatrist. I'm in Annapolis, Maryland. My private practice is Elite Excellence Psychiatry Consulting and Coaching. So, what I do is I evaluate and I treat a mental illness in children and adults. It's a passion of mine, especially in the African American community and in communities of color, to really educate our people, our families, our children about what mental illness looks like, about the treatment options that are available through either, therapy, medication management, combination of the two, also healthy lifestyle changes. And I just love, helping people to understand that mental illness happens to some of everyone. And so it's not just certain people, it could happen to any one of us at any moment. And so, really taking care of your mental health is important and should be a priority and not something to shy away from or be embarrassed about.
Absolutely, absolutely. So thank you so much for jumping on. And I know I said this to you earlier, but I want to put this on record. Thank you so much for the work that you do. Um, Being a Black woman psychiatrist, I mean, in this space, we know what the figures look like. There just aren't
Mhm.
enough of us, and aren't many of us, especially as psychiatrists. So I definitely want to say thank you so much for what you do for our community.
Thank you. I love what I do.
Awesome. So the first question I wanted to throw out, we talk a lot in this space, and when we're engaging with people in the community and out and about, like we talk a lot about, everyone should have a therapist. Like you should, go into therapist, have a mental health professional. You need a psychiatrist. Like all these different terms that we talk about. And so I think a lot of us and a lot of people in our community are familiar more so with therapy and kind of what therapy is. Can you explain the difference between a therapist and a psychiatrist, for those watching this?
Sure. Yeah. So the difference between a therapist and a therapist is usually someone that you may seek out first if there's a problem or a major family change or life change that can kind of help you figure out exactly how that problem is affecting you and can help you really come up with coping skills to help you better deal with the problem. They can also help you identify problematic patterns of behavior and figure out good solutions to deal with those better or even help families kind of function better within the unit or even in between with communication with one another. So usually their background is in potentially social work or professional counseling. But a psychiatrist is an actual medical doctor. So they've gone through medical school. They've trained to know the different diseases that can plague the body, but also the mind. And they've chosen to specialize in psychiatry, which really is a science of, emotion, feelings, and also some behavioral disorders as well. And psychiatrists can not only diagnose these different conditions, but they can delineate if there are medical things that may mimic the symptoms of mental illness, but they also can treat mental illness either through medication management or even therapy as well.
Yeah, that's a great breakdown of the two, and I think people, oftentimes we don't know about that medication piece. Like that medication piece is a critical thing and can be scary for a lot of people, and some people shy away from it. But it's good to know where those backgrounds are in therapists and for psychiatrists. So
Definitely.
I'm a parent, so right, so I have a 9-year old and a 7-year old. They are somewhere away from here because they make the utmost noise every time I record something, right? They always find a way. And so, as parents, we're always looking. We're always, are you good physically? Like, are you good mentally? And now I think we're in the space where, people across the board, thankfully, like there's been this new renaissance in parents really focusing on mental health even in our community. It's been a beautiful thing to see that progressing. And so as a part of that, a parent may notice something in a child, especially during this pandemic time. Like everyone's kind of
Right.
rightfully so being really hyper vigilant and are they okay. They're away from their friends, they're isolated, and trying to
Mhm.
figure out some things. So there may be some parents watching this who are like, I'm seeing some things, I'm concerned about some things, concerned about others, and I'm trying to kind of figure out when is the right time, when should I take my child to a psychiatrist, kind of, and what do you think, from your expertise, what are some of the signs that a parent may see that they may say, what, it may be time to take my child to a psychiatrist.
Okay, so that's a really good question. So the thing is, again, like we had mentioned before, often if there's a big change in family or in life, and you may see some symptoms like changes in behavior, some changes in mood, some changes in the way that your child may be responding to things, initially you would go to a therapist to see if you can kind of help problem solve. Okay, what's the cause of this? What's going on? How can we cope with it? But when you really start to see a decline in function, so if the child's grades are really, dropping, if they have withdrawn from friends or even family, if you notice that, sleep patterns or eating patterns have changed, if you're noticing that they may be maybe preoccupied with like death or making mention of, I don't want to be here, if it seems like the mood has really declined, or even if you're seeing a lot of aggressive behavior or major change in behavior, I would say that those are the times to really start to seek out a psychiatrist to try to really figure out what's going on and how we can intervene early to prevent any further decline in the future and even to restore them back to their normal functioning.
Awesome. That's a really good point. In watching that functioning piece, and how to really understand, from therapist to psychiatrist. And I like that you've bridged those two, that, to start with the therapist and start
Mhm.
there and kind of go there initially to see what they're able to do. And then if things, progress or aren't getting better, or become more severe and impacts functioning, to then seek a psychiatrist.
Absolutely. And I'm a parent too. So I totally understand that perspective. No one really wants to have to put their child on medication if it's not necessary. And a lot of times in the beginning, it may not be. And so it's good to start with therapy and even to continue therapy, even if you are seeing a psychiatrist, because I believe both of those are really valuable pieces to, treating mental health and just maintaining mental wellness. So due to that, I even do therapy myself. I'm one of the few psychiatrists that really like to do therapy and try to infuse it even in my medication management sessions. But I do even have some patients that I see just for therapy alone. So I think therapy is crucial and should really be the first step.
Wow, wow. So you're even more of a unicorn than we thought in the beginning with that. That's awesome.
Thank
That's
you.
awesome. And so, so if a parent, they have their child in therapy, they're working on these things, things are not progressing as they thought, things are getting
Mhm.
worse. Things are deteriorating, and they're like, you know what? I think I'm gonna go take my child to a psychiatrist. And so they make that step. What should they expect when initially, they find a psychiatrist and they're like, this is the first session. What should a parent anticipate during that first session when they take their child to a psychiatrist?
Okay. Okay. So that's a good question. So definitely during that first initial encounter with a psychiatrist, you're going to be there with a psychiatrist for about an hour. Some people do a little bit longer, maybe even an hour and a half. But there's going to be a lot of questions that are asked. So not only questions about the symptoms that your child may be displaying. So again, kind of asking about mood. Are there any issues with nervousness, anxiety? Is there any timidity? Is there changes in sleep, appetite, energy, concentration, that type of thing, but they're also going to ask about past symptoms, if there were past inciting factors that may have caused some of the symptoms currently, if there were any traumas, if there are any special family dynamics that may come into play, any major life changes, any major family changes. They're going to also ask about past treatment. Have you seen a therapist? Have you seen a psychiatrist in the past? Has there been medication management in the past? A psychiatrist will also ask about any medical conditions. Are there any conditions that may even contribute to some of the symptoms? So, for instance, we're all indoors nowadays, so a lot of us are not getting sunlight like we should. When we, get sunlight, our body will naturally make vitamin D, and so a lot of people are vitamin D deficient right now because we're not getting that sunlight like we should. And vitamin deficiency can look like lethargy. It can look like depressive type of symptomatology and symptoms. It can make you feel very sluggish. And so it's going to be important to see, is there anemia? Is there vitamin D deficiency? Are there other medical conditions that could present as if it's depression or anxiety or some other disorder as well? Psychiatrists are going to ask if you're on any other medications for any medical reasons, any allergies. They're going to ask about, past social history. Where was the child born? What's the family dynamic? Who lives at home? What are some of the coping skills? What are the fun activities that the child is engaged in? How are they doing in school? Any special education involved? And just really get a good comprehensive background, medical, family history, social history, et cetera, that will help to put the whole picture together so that the psychiatrist can make a comprehensive diagnosis and also come up with a comprehensive treatment plan to address the symptoms of concern.
That is great to get that background and to get that breakdown of kind of what to expect. And so
Mhm.
basically, like there's a lot of kind of history and fact finding
Exactly.
in that first session to make sure that whatever treatment plan is decided upon, that it's built on what we already know, right?
Exactly.
That's great. And so should parents kind of, if they're thinking about doing that, would it make sense to kind of write down some observations first? Like should they, journal anything down? Should they bring anything with them on their first session?
I think that would be great. Yeah, if you could, write down what the major symptoms are, the major areas of concern that you have before seeing a psychiatrist. If you even have video, I have some parents come in with like, look, my child is doing this. And that can be helpful, especially if you're concerned about maybe like a tic disorder or a movement disorder. It would help for us to see it, when it's occurring. Also, if you can bring in like a list of medications that the child may be on, or even the doses, the names, et cetera, and even any medical conditions, that's helpful. Any previous school records. So if they've had any IEPs in place,
Mm.
so individual educational plans, 504 plans, if they've had any type of psychological educational testing done, all of that's really helpful for us to put the whole picture together and figure out how to treat the child and the family, as a whole, not just, okay, they seem like they're depressed. Let's just go with that, because it could be
Mhm.
so many other factors that come into play.
That's great. That's great. Thanks for breaking that down.
Sure.
And so with, this is the Black Mental Wellness Lounge. And so, we know from, from work and from what, we've seen in evidence and research and in
Mhm.
literature that we do better when we have a Black clinician, right?
Yes.
Like we know those outcomes are there. It's, well documented. And we also know what's well documented is that there just aren't enough Black clinicians in the mental health space, and it really in any space, but specifically in the mental health space, for everybody to find a Black psychiatrist. However, we want to try to connect people with what is going to, serve them best. And so, with that, are there any if a person looking at this is like, I want to find a Black psychiatrist, like I want to take my child to this Black psychiatrist, how would they go about finding a Black psychiatrist? Are there any resources or anything that may be helpful in that search?
Okay. I think Psychology Today is a really good resource to find specific clinicians that you're looking for, because they'll kind of narrow it down for you in terms of, do they take insurance? Do they not? Do they focus on these particular disorders? You can tell from the pictures who's ethnic, who's not. And, you can get a lot of good information to kind of direct your search of finding what you're looking for. I know sometimes when I'm looking for other clinicians of color to refer people to as well, I will go to Psychology Today, and have been really successful in, identifying exactly who may be, relatable and better suited to treat, our people of color. Another good resource as well is the website Therapy for Black Girls. I believe that's the right one. But they often have a lot of clinicians of color, oftentimes therapists, but I have seen a few Black psychiatrists listed there as well. So Psychology Today, Therapy for Black Girls are two really great resources that I'm aware of.
That's awesome. That's awesome. And we'll link those in the video also so people can check those out. And so, we talked about you being a unicorn. You've done a lot of different things, and also you've just written a book, right? Tell us about the book.
Sure, sure. So, again, I'm really consider it a privilege to be able to work one-on-one with people and to make a difference in my patients' lives. But I definitely wanted to see if I could have a bit of a broader reach. I'm really an advocate of families. I'm an advocate of parents spending quality time with their kids and really sharing that time for bonding to really get to know them, but also time to impart values and good character traits and, help them to explore, what they want to do in the future, how they want to make a difference. And so what I did was I wrote a book, and I actually have it here if I can show it.
Yes, absolutely.
It's called Who Will I Be? It's All Up to Me. I wrote it and illustrated it. And I love, during the pandemic, like you said, the Black Mental Wellness Lounge has been kind of your passion project during the pandemic. So this book was my passion project during the pandemic as well. And I really had some downtime so that I could really illustrate this book because I actually wrote it 3 years ago, but I really
Oh,
got a chance to illustrate it. So it was so much fun. But basically, with this book, I really want to make it easy for parents to have the discussion with their kids, not just about what they want to be when they grow up, but about who they want to be when they grow up. So the type of person they want to be, the type of difference that they want to make. And so in this book, I really highlight different scenarios and different ways in which kids can be of service to others and can really exude qualities such as kindness and compassion, embrace diversity, include people no matter where they're from or what they look like, and really seek to make a difference in people's lives. And then it also seeks to empower them that if they embody these positive character traits, that they can accomplish any goal they set forth for themselves. They can be change leaders, and that they can really make a difference, not only in their lives and their communities, but in the world in general. So definitely, I tried to use some really colorful illustrations. Whoops, if I can kind of get it open. And it really reflects, people of color. It shows people of color doing great things. And I think that that's also something that, our young Black girls and boys need to see, that they can be doctors, they can be lawyers, they can be, engineers, they can be, firefighters and all these other positive, careers and professions that really make a positive difference in people's lives. And so that was a passion project that I pursued. And it really is about my son as well. So it shows him pondering all these things and looking at all these values and exuding all these character traits in a positive way.
that's so cool. That's so cool. And so, yeah, so I'm definitely, so is it, how, if people want the book, where should they go to order it?
Thank you for asking. So yes, it's available through ebook and also in print on Amazon. So if you look up Who Will I Be? It's All Up to Me by Dr. Maria Tranquori, you'll see it there on Amazon.
Awesome, awesome. And so I'm definitely gonna go get my copy, and I'll also
You.
commit to the first people that reach out to me, first three people that reach out to me on Instagram, on YouTube, or wherever who want the book, I'll get the book and send it to them.
That's awesome. Thank you so much.
No, of course, we gotta support each other, right?
Absolutely. Absolutely.
Awesome, awesome. So thank you so much for your time and your energy and your experience and sharing that with us in the lounge today. How, if people want to get in touch with you, they want to know more about your work, get connected to you on social media. How would they go about doing that?
Okay, sure. The best way to reach me is through my website. So eliteexcellencemd.com. So that's ELITEEXCELLENCEMD.com. So eliteexcellencemd.com. And through the website, you can also connect with me through social media, either through LinkedIn, Facebook, or Instagram.
Awesome, awesome. Thank you so much again, Dr. Corey. I appreciate you, the work that you've done, the book, the things that you continue to do. And thank you so much for stopping by the lounge. I truly appreciate it.
The pleasure is all mine. Thank you so much, Brandon, for what you're doing and for truly making a difference in our community.
Thank you. I
God bless.
appreciate that. Thank you.
Very welcome.
So awesome. Thank you all so much. And we'll be back with another episode soon. So thank you all so very much.